Shifting now to news on the COVID-19 fight, two studies reveal the Johnson & Johnson vaccine protects against the Delta variant. Researchers found that the one-dose vaccine generated neutralizing antibodies against the range of variants. Johnson & Johnson says the shot elicits both a lasting antibody response and generates immune cells that last 8 months. Let's discuss this development with Doctor Nina Gloriani, the DOST vaccine expert panel head. Doctor, thank you so much for joining us. What do you and the panel know about this one-shot Johnson & Johnson and its efficacy against the Delta variant?
Well, this is very new, no? The efficacy, it was not actually stated, but what they said was the antibodies against the Delta variant that actually neutralized the Delta variant were higher in titer, what we call the titer, higher than what they found for antibodies that would neutralize the South African variant. So this is better news. I mean, after one dose, that is really good news. And then they also said that the T-cell responses, especially what we call the CD8 cells, these are the killer cells, the cells that would kill the virus, were also still high at the time at 8 months. So both the humoral and cellular immune responses were high even at 8 months.
So Doctor, the J&J one-shot vaccines will only be available to Filipinos towards the third and fourth quarter of this year. But do you already have access to the key research from the trials that are taking place overseas?
Oh, yes, because they have published their data. You know, the ensemble clinical trial was published last April 2021, yes, this April. And we already have data, even the efficacy against the alpha, the beta, and the gamma variants were relatively high after one dose.
And what about the current vaccine supply? Doctor, you have Sinovac, you have Sputnik V, Astra, Pfizer, and Moderna. What have your studies revealed? Do they provide really adequate protection against the alpha, the beta, and the gamma, and the Delta variants?
Well, we have sort of interim data from Pfizer and AstraZeneca for the Delta variant, and the efficacy is around 30 to 35% after one dose, and it goes up to around 70 to more than 80% after the second dose. So if you compare it with, not that you can really compare, no, because some of this data you have to go into some very technical details, the one dose of Janssen seems better.
What about Sinovac? What about Sinovac? Because there was a CNN report that revealed that in Chile and in some parts of Asia that has a high vaccination rate for Sinovac, the efficacy is quite low.
No. What is important for Sinovac is that the 2 doses will give you better protection. That is what we have seen so far. You really need at least 2 doses to give you the protection that you need. But you know what happened in Indonesia when they had a lot of these variants, those who actually got the COVID after vaccination were due to the variant, but they only had mild to moderate COVID.
So Doctor, you know, a lot of our kababayans have already had their 2 doses of Sinovac, AstraZeneca. Some have already had Pfizer and Sputnik V. The big question here is, for how long do these 2 shots provide us with immunity?
Well, as far as we know, some of these vaccines already have data up to around 9 months. So they still have antibodies. So we're monitoring closely so that maybe by the end of the year or towards the third quarter of the year, we may be able to give some recommendations on the possibility of giving boosters or third shot.
Yeah, that is my next question, Dr. Gloriani, no? The booster shot, everyone is talking about it. For those who received, let's say, their first shot in May and the second dose in June, what is the ideal time to get a booster shot? And is a booster shot an additional dose from one of the 2 doses we get injected with? Or is it a separate, more stronger dose or another brand?
Well, there are 3 possibilities that the WHO is actually looking into. course, we can give the same dose, the prototype vaccine that we used for the primary immunization. Another possibility is the updated version, or what we call the modified version, that contains the prototype strain plus the variant strain. And a lot of these vaccine companies are actually working on the different strains. Some are actually including the South African variant. Some are including all of them, alpha, beta, gamma, delta, and some may probably just use delta. Now, it really depends on what will prove to be very efficacious. And the third choice is an entirely new vaccine, which probably will not be the one that will be used. I'm really betting on more the modified version.
And we'll have to wait and see what the advice of the World Health Organization will be on
Yeah.
how the booster shot will be used. Thank you so much for joining us on The Final Word, Dr. Nina Gloriani from the DOST Vaccine Expert Panel.